Good morning. My name is Kimberly. I'm going to be your nurse today. I was looking over your health record and it shows that you're due for a dressing change. Is that okay if I do that for you?
Yeah.
Okay, I'm going to go ahead and start with some hand hygiene. And I'm going to go ahead and put my PPE on, starting with my gown. Okay, I'm going to go ahead and now place my mask on. Oh, my gown came untied. Go ahead and tie that better. I'm going to go ahead and place my goggles on. And I'm going to go ahead and identify my patient. Okay. Can you say your full name for me?
Jamie Briel.
Can you say your birth date for me?
August 27, 2002.
Okay, this is the correct patient. I'm going to go ahead and assess for any need of analgesics. And there is no need for analgesics. I'm going to go ahead and close my curtain. Okay, I'm going to go ahead and explain the procedure. So today I'm going to go ahead and remove your old dressing. I'm going to clean it up and apply a whole new one. Okay?
Okay.
And now I'm going to show that I have my trash can here ready. I have all my equipment set out and ready. And I'm going to go ahead and lift and raise the bed up to my elbow height. Okay, that should be good. I'm going to go ahead and check for any positions of tubings or drains. And there seems to be no tubings or drains. I'm going to go ahead and lower the bed rail. I'm going to go ahead and place some gloves on. And I'm going to go ahead and expose the dressing.
No, she wants to film. She wants to film, but I don't want to because I want to get out of here.
Okay, using the push-pull method, I'm going to go ahead and start with the corners.
Do our debriefing thing, nursing diagnoses.
Okay, start with this corner now. And now this corner. And I'm just going to keep push-pulling to remove my old dressing. Okay, after I remove the dressing, I'm going to go ahead and inspect it for any type, amount, color, or odor of drainage. There seems to be none, so I would go ahead and place this in the trash. I'm going to go ahead and now assess the wound. There is staples, it's no bruising and no edema, but there is some erythema present. Okay, now that I've removed and assessed, I'm going to go ahead and measure.
It's not on our list.
Using the centimeter size. There is 6.
We got rid of it. Okay. So you don't even have to validate on that. I spent way too much time on it. Yeah, that's why, because it says NG insertional removal. Yeah.
Okay.
Fully on it. So
Length of the wound is 8 centimeters and width of the wound is 1 centimeter. I'm I'm gonna go ahead and now take off my gloves. Do some hand hygiene. And I'm gonna go ahead and set up my sterile field. Starting with my drape. Hopefully I can get this open. Okay. I'm gonna open away from me and drop onto the sterile field. I'm gonna go ahead and throw that away. I'm gonna go ahead and using the 1-inch barrier that I have, open up my drape. Not reaching over, make sure not to contaminate it. Okay, now I'm going to go ahead and get my ointment, open it up, squirt some on there. I'm gonna get my gauze, again, opening it up away from me and onto my sterile field, letting it drop onto my sterile field. Now getting my abdominal pad, again, opening it away from me, letting it drop onto the sterile field. There we go. Letting these Q-tips drop onto my sterile field. There we go. And I'm gonna go ahead and get 5 pieces of tape. How do you do this too? Oh, there we go. I think. So, there we go. Okay. Hopefully this doesn't take that long. There we go. So again, 5 pieces of tape.
Georgia. Georgia. Georgia.
And on my 5th piece of tape, I'm going to go ahead and grab my pen and write the date, the time, and my initials. And I'm going to go ahead and paste that over here as well. Okay, now I'm going to go ahead and grab my sterile gloves. And I'm going to go ahead and making sure I don't give my back to the wound or to the sterile field, I'm going to place my sterile gloves on. Starting with my dominant hand. Starting with my dominant hand, I'm going to place my glove on. And then placing my non-dominant hand glove on.
So I just put the bolded word down, so this is correct start with what we saw, it was bolded. You would do both. Oh, okay. There's so many of them.
Okay, making sure I do not break sterility. I'm gonna go ahead and just set up my station. Make sure the blue line's facing up. Gonna go ahead and start with 1 Q-tip. One Q-tip, put it in my ointment. Starting with one side only. Okay, dropping it into my trash can. Get the other Q-tip, dip it in my ointment. Doing the other half. Okay, dropping it in the trash can. Now I'm going to take one, drop it onto my wound, and I'm going to take another one, dropping it onto my wound, take my abdominal pad, place this on top of my wound. Now I will go ahead and be able to grab my pieces of tape the tape with my initials, the date, and the time right there. Okay, that looks good. I'm now going to take off my gloves. I'm gonna go ahead and clean up my area. I'm gonna go ahead and make the patient comfortable and make sure to cover her up. Lifting the bedroll back up. And I'm gonna go ahead and lower her. Okay, I'm now going to go ahead and remove my PPE, starting with my gown.
I was going through reading and like highlighting what I think is important, but like these chapters like 50 pages and there's nine. And like I didn't get the book until later, so I'm like,
I'll just get burned out.
Well,
You guys have the Saunders with
It's
the
not.
section cut book. This is a hack that I did in nursing school that helped me. I had the Saunders cut
it's
book,
knotted.
and for whatever like I was learning in class, I would read that first because it was like 3 pages, and then that's like the key stuff that you need to know for your class. Then I would go back in and try to read the chapter and make it like vaguely, yeah.
but I just like since the
Almost got it.
I don't know if I should buy any like synthetic.
It's the next gen.
Oh,
I just bought it, yeah.
Oh my god, that's just... Okay, I'm gonna go ahead and shimmy it up, throw it away, take off my goggles, take off my mask, go ahead and throw that away, some hand hygiene. Okay, and I'm just gonna go ahead and let you know they will be coming in here at least once a shift to check on the dressing. If you don't need anything else, I'll go ahead and leave you alone, and thank you for letting me take care of you.